Welcome, listeners. I am joined today by two board-certified microsurgeons who work together in Tucson, Arizona. You can see that by the lovely sign that is behind them. And they work at Tucson Plastic Surgery. I'm joined by Dr. Raman Mahabir and his surgical colleague, Dr. Silvia Kurtovic. Originally from Canada, Dr. Mahabir completed a 5-year integrated accredited plastic surgery residency at the University of Calgary in Alberta, Canada. Dr. Mahabir simultaneously earned a master's degree with a focus on post-operative pain control. We're going to talk about that today. To ensure he would be able to offer his patients unsurpassed care, he completed fellowships at the University of Las Vegas in aesthetic surgery, breast surgery, and microsurgery. Dr. Mahabir chose to pursue an academic career after the completion of his training. The first stage of his practice was at Baylor Scott White in Texas, and while there, his practice focused on complex breast, body, and facial cosmetic reconstructive surgery. He quickly built a reputation as a caring physician with impressive outcomes. His contributions to education, which twice earned him the Teacher of the Year award, and research endeavors, over 1,000 publications, dozens of book chapters, and hundreds of presentations internationally and nationally, eventually led the Mayo Clinic to hire him to be the chair of plastic surgery in Arizona. While at Mayo Clinic, Dr. Mahabir was promoted to full professor and received numerous academic awards. Now he is in Tucson, Arizona, and I would like to introduce Dr. Kurtovic. She grew up in Southern California and graduated with honors from the University of California in Los Angeles in physiological sciences. Upon earning her medical degree in New York, she completed a decade of rigorous postgraduate surgical training in top-ranking residency and fellowship programs in North America. She did her general surgery at Cedars-Sinai Medical Center in Los Angeles, at which time she developed her interest and her interest in the artistry of plastic surgery. Wow, that's a lot to get out. You guys are so well qualified. Dr. Kurtovic was inspired by the ability of plastic surgeons to transform and restore the human body, and she chose to pursue further specialization in plastic and reconstructive surgery at Duke University. After that, she completed 2 additional fellowships in microsurgery and cosmetic surgery in Canada. Did you guys meet in Canada after all of those wonderful accolades?
No.
You did not. Okay, well,
No.
we will have to find that out, but I'm just wondering because you both have that Canadian connection. And I have to say, this is the first time that I have met you, Dr. Kurtovic, but I have known Dr. Mahabir for a little bit. And I think what I've always appreciated about you is that you've had a keen interest in patient education and patient advocacy. And I have a sense Dr. Kurtovic is right along those lines too.
Yep, you're right about that.
I'm so pleased to have you both. Welcome.
Thank
We're
you.
glad to be here. Thank you for inviting us.
Yeah. Well, how about if we start off and each of you tell me really, I mean, I gave a lot of your background, but why did you choose Tucson to open your plastic surgery clinic and practice, and why go into plastic surgery? Especially, I know you guys specialize in autologous breast reconstruction. You have a passion for that.
Yeah, before I even answer that question, I do want to go back and say we have known each other a while. And I want to thank you for all the work you do. Our patients and patients across the country and probably well beyond that are so much better off because of the work you're doing, the information you're getting out there to patients, and really the whole concept of shared decision making, where patients have the information to intelligently be able to make the decisions that are right and best for them. The work you're doing is invaluable in that effort. And we see the results that we see patients coming in, knowing what they want, better educated. And so it's only a win-win-win. So the work you're doing really is important, and please keep doing it. We're proud to be part of it.
Wow. That really makes me feel good. Thank you for mentioning that. And I've always said I couldn't do this alone. So collaborating with microsurgeons like yourselves is even more important to me. And I appreciate it because patients do like hearing from you.
Well, it's easy for us to get caught up in the work we do. I mean, we love it, and so it can be fairly consuming, and we wouldn't necessarily set aside the time to sit down and do these things. So while we're helping a patient one at a time, you're helping the patients states and countries at a time. So this stuff's really important that you're doing.
Yeah.
But getting back to answer your question, why Tucson? Well, when we met, we did meet at Duke University, and we can tell that story if you want. But
It's
when
not
we
that interesting.
I
It's
had
not that.
I had no, see, it is interesting to me. What a great program.
Well,
And
here, I'll tell
so,
you that part, and he can finish
yeah,
the question.
yes,
So
please dive in
I
here.
was I was in my residency there, and he was one of the professors that they rallied together from all over the world, microsurgeons, to teach at one of their really well-known microsurgery flap courses that attracts people from all over. And so he was one of the professors, and we met and we were friends and collegial, and he was really a mentor to me, and helped sort of inspire me further on my career path to do training in microsurgery and breast reconstruction. But anyway, we didn't start dating until COVID. We sort of reconnected after many years, and then it just things just fell into place fast. And then I was in Austin in private practice, and he was in Scottsdale, and we were deciding on where we wanted to have our lives, have a family, and so yeah, tell how we end up in Tucson.
Well, I mean, we knew we're going to start something special of our own design, and really wanted to create our vision. And knowing that we had to start over, we said, well, we can start anywhere we want. So then the question becomes, where do you want to start? We both love the desert. We love the climate. Scottsdale wasn't necessarily the right fit. It's a big city, and we were looking for something a little smaller. And we came to Tucson a few times, and I mean, it's easy to just fall in love with Tucson, the mountains, the outdoors, and the added benefit. I mean, we always knew that people were great, but I will tell you that every day I'm in clinic, almost every patient that walks in the door are genuinely just good, authentic people that you want to help. So it's about creating a patient experience, helping them on their journey. And Tucson just gave us the opportunity to live in a place we love, to do the work we love doing. And now we've started our family here, and the universe is taking care of everything else. So
I know. Congratulations on that new little one. I've seen pictures. I'm so happy for both of you. Listen, I have to just add something personal here. So I lived in Tucson.
Wow.
I lived in Tucson for 10 years. You may not have known this, Dr. Kurtovic, but there was not a robust deep flap presence when
Oh,
yeah,
even
you,
when we came, it was non-existent.
I,
So
I
that
know
was
this was in 2014. Now,
Mhm.
I will say, I will add to that, well, so to back up, I went to Texas for my reconstruction because there wasn't that great of a presence at the time. So there's that. You kind of guys are doing the switch on me. You were in Austin, now
Yeah,
you're in Tucson.
yeah, exactly.
But I have to tell you, there is a very robust breast surgery presence in Tucson. I still am good friends with the breast surgeon who did my double mastectomy there. But I have to tell you both, I was recently at the breast surgeons conference in Orlando in April 2024, and this is, we're filming this about a month later. Were your ears burning? Your name got brought up. I was talking to breast surgeons and they said, that's who we send if anyone wants to have a DIEP. We go straight to Dr. Mahabir and Dr. Kurtovic. So this is kind of a full circle moment for me in a way. Yeah, so that's a great story. And I just told someone about what a great they were looking at different surgeons and so forth. This is in another part of the country. And their surgeon had gone to Duke, and I said, they have an excellent flap course there. So the fact that you guys met there, that's really cool. I did not know that. I did not know that story. Duke flap course. Big
Well, the
shout
fact
out.
that you even know what that is, that
Yeah.
says a lot, I think.
Yeah. It's a
Yeah.
great event there in Duke. Okay. So I have really lately been trying to shine a light, promote the two-surgeon model in microvascular breast reconstruction. I think it's so important for patients to know why. And we know there are plenty of microsurgeons who do their surgery as a single surgeon. But if patients can seek the two-surgeon model, I'd like for you guys to address the advantages and how you both have great advantage for each other working in the two-surgeon model.
Yeah, I agree with you. There's a huge advantage for patients, and some of the advantages are obvious. For example, time. If you have two board-certified plastic surgeons working at the same time, you're essentially accomplishing twice as much work, and the surgery can literally take half the time. Half the time can mean half the anesthesia, and we do know that while anesthesia is safe, it is cumulative. It builds up in your system, so the longer you're asleep, the longer it takes to bounce back. And that's the most obvious one, is that we can do a bilateral deep flap in 6 or 7 hours. And if you're doing it all alone, it's gonna take you a little longer, and maybe a lot longer.
Yeah.
But there's other advantages too, because each surgeon can bring a unique skill set. And Dr. Kurtovic, you can speak to that because we see that almost every time we work together.
Yeah, I think there are a lot of advantages, definitely what Dr. Mahabir said, but also you're having two different minds that are, approaching a challenge from two different angles and bring different things to the table. And I think it makes for better outcomes for us. Definitely, patient safety is a huge priority and being efficient in the OR. But the other thing that's a priority is, aesthetics. It's not just about putting a piece of tissue up there and who cares, just close, be done. We think about all of those aesthetic components because when we are done, we want to minimize the amount of time or amount of surgeries that patient might need in terms of revision. So if we can nail everything and plan up front, and that's what we often do, is we'll plan their surgery, we talk about it, we both see every patient, I'll see his patient, he sees mine, because then we'll come up with certain ideas that we can then be better prepared for up front and execute that better. And just get an optimal aesthetic result overall, safe and efficient.
And a benefit that's maybe even a little less obvious is energy and capacity for decision making. If a surgery takes you 6 or 7 hours and you're both closing at the end, you still have that extra energy to say, you know what, let's make sure we get this tummy just right, the belly button just right, as opposed to, okay, we're 12 hours into this, we're just going to close the belly and we just get this done and get the patient off the table, and then we'll fix the rest of it later. We still have the ability, capacity to really emphasize all of those things as we're trying to fine tune every little bit of it.
Yeah, and I have to say too, from a reality standpoint, like you said, you talk about your surgery the day before, the evening before, you plan it, but not everything just falls into place when you're there on the OR, on the table or when the patient's on the table. So having two surgeons discuss it and be able to pivot and do those plan Bs sometimes. I think from a patient perspective, I like to tell patients that I think that is another valuable part of having the two surgeon model. And there are studies, there's research that shows us that patient safety, patient outcomes are better because of a two surgeon model. So, yeah. This is a good segue because something else that kind of aligns with this is pain control using ARAS protocol. Tell us about that and the benefits for patients using ARAS. And tell us what it is first, what it stands for, because I don't want to assume anyone knows what it is. Someone just told me the other day, a patient, ask a surgeon.
Is it the Taylor Swift concert? I couldn't help but
Oh,
throw that in because
I've
I
seen it.
sometimes I think, oh, that's ERAS.
I've seen that. Yes. Yes, I
Sorry,
have seen that.
I had to throw that in.
I'm glad you did. And I totally forgot about it. You made me smile. So anyway, go ahead and tell us about the ARAS protocol in microsurgery, not at the Taylor Swift concert.
Enhanced recovery after surgery
Mhm.
is in a complete protocol, and a protocol that starts weeks actually before the surgery. Dr. Kurtovic is going to talk a little bit more about that later if it comes up, but it really is about preparing the patient right for surgery, getting expectations right in the pre-op area before the patient ever goes to sleep, making sure they get the right combination of medicines, the right care, the right warming, the right preparation for the operating room, setting up the operating room, making sure your anesthesiologists are on board. And we have a protocol with the hospital we work at. We have a protocol that all the anesthesiologists have agreed to and they follow, which is fantastic. They're really on board with this because they see the benefits too to our patients.
Mm.
And then there's all of the intraoperative parts of it, that, as well as the postoperative parts. And I know you've done podcasts and blogs on enhanced recovery after surgery, or ERAS, so I won't elaborate on all of them, but I think there's one that really is they're all important elements and there's no one part that's more important. But at the same time, the local anesthetic part of it is probably the part that plays the biggest factor in patient comfort and experience.
Mm-hmm.
And we have negotiated with our hospital to be able to use Exparel.
Mm.
Exparel is a very special and relatively new drug that not everybody either uses or can use because it's very expensive, and the hospitals initially are often reluctant to bring it on. But most patients have had lidocaine at one point in their lives, either for a small laceration or for their teeth, and everything goes numb for 3 to 4 hours. That's a local anesthetic. Exparel is a local anesthetic that they've packaged in a certain way that when you inject it, it will last 3 to 4 days.
Mm.
So rather than just a couple of hours of pain relief, which might just be the surgery, we can now give our patients that same pain relief for the first 3 to 4 days, which is really when the critical highest parts of discomfort are present.
Mm-hmm.
And we do those blocks while the patients are asleep. In fact, we do the blocks before we do the surgery, because even though you're asleep, your brain still gets all the signals that it would have gotten. And when you wake up, it's now processing those. So that's why a lot of patients wake up in pain. Their body's processing all those signals they got. So we take the Exparel and we inject it in the breast, in the tummy, and we're able to create a local anesthetic effect so that the brain never gets those signals.
Mm.
And 9 times out of 10, when our patients wake up, they don't have any discomfort. Their throat's a little sore from the tube, or their elbows might be a little sore from positioning,
Mm-hmm.
but it's a little sore.
Right.
Another advantage of Exparel is it's not just a sensory paralytic, it also can have some motor paralytic effects.
Mm.
And we're doing deep flaps, so we're not taking the muscle, but you do have to dissect the muscle to get the artery and vein out.
Right.
When you do that, you can get some muscle spasms.
Mm.
Dr. Kurtovic and I also plicate the muscle, just like we would in a tummy tuck. So we not just making breasts, we want to make their tummy look better. So we're going to do all the steps of a tummy tuck. But when you plicate that muscle, you can really get some muscle spasms. So we paralyze the rectus abdominis with rectus blocks. We numb the abdomen with tap blocks. We numb the breast with intercostal blocks. And the combination of all of that is less discomfort, less need for narcotics, less nausea and vomiting, less problems with bowel issues afterwards, less risk of addiction, because even though that's a small thing, it's a very real thing. So we take that very serious. And our goal with our ERAS protocols is really to try and help our patients absolutely minimize and maybe never use a narcotic. We have them use Tylenol, anti-inflammatories, muscle relaxants, and oftentimes that's enough with the X-Pro.
Yeah, yeah. So that was a great explanation. Dr. Kurtovic, I want to ask you a question because you watched your own mother go through breast cancer. You have the full scope of diagnosis, caregiving, all your surgical training. But something that I think is really rolled into your compassionate care and what I've read about for your patients is that you prepare them. And I'm going back to what Dr. Mahabir said about getting them ready, ARAS 2 or 3 weeks before. You really prepare your patients, both physically and emotionally for this surgery. Do you want to talk to us about that?
Sure. It's actually something that I really enjoy the most
Mm-hmm.
because over the years, what I've noticed, just as treating various types of patients who've had different situations, immediate reconstruction to revisions, and seeing how people progress through different surgeries through different outcomes and scarring and complications, and then noticing how they get affected emotionally with all of that. I think in medicine today, it's starting to come out, but a lot of times doctors don't spend a lot of time, talking about the emotional part of it and what they're feeling and just validating that for the patient. I think that's really important, especially when surgery is involved, because one of the things that I really believe in, we have for DIEP flaps, we do a lot of revision work, or patients who've had mastectomies and they're flat, or they have, radiation or implants or things like that, more than we're doing immediate. So in particular with these patients, they've had a lot of surgery, a lot of emotional trauma. I tune into that. That's something I've always had, and just now it's more interesting because I can have different conversations because they're my patients. But I like to talk about that and just nudge them a little bit and say, hey, we're going to be going back into the area where you've had your mastectomy, you've had radiation, you're having all these issues, you have lack of mobility, or whatever it is that they're dealing with. And a lot of times they're dealing in silence, and they're suffering in silence because they just don't know what else to do. And they don't realize that there is a way out. And I like to tell them, this is an opportunity. You're having a new surgery, a completely new experience, and it's an opportunity to change and shift what happened and to create healing for yourself. You've gone through all of this, here you are, and now your body is really ready to heal, and it can do it. All you have to do is just believe in that. And I just leave it at that. And I think that helps people feel a bit more at ease. And I want them to feel going into the DIEP flap reconstruction surgery as if it's not cosmetic, but I don't want to bring in it shouldn't be traumatic. It shouldn't be stressful, right? It's not a cancer operation. It's a healing operation. And so I tell them, look, what tends to happen to some people is you go in, you open up that previous surgical scar. It's not uncommon to have a lot of emotions come up. So don't be surprised. And when you feel them, let them out, let them go. Your body knows what it needs to do. And we're here to help you so that we can help your body do what it wants to do naturally.
I have goosebumps right now. I mean, I've been through this process, and for you to say that to your patients, that is emotional empowerment. Because I have to say, I'm guessing that both of you has sat in front of patients that have just almost felt frozen or looked frozen, not knowing how to kind of open those feelings up. So that is so powerful that you do that, Dr. Kurtovic. And that is a beautiful part of embracing the journey that these, women have gone through, because it varies so much. The emotional impact, the emotional trauma varies so much from patient to patient.
And they're not always ready. I think when I started this, I used to think, oh, well, don't you want to heal? Don't you? Everyone wants that. Well, I realized actually everyone's on a different timeline.
Mhm.
And all I do is plant seeds. I say a word, they half the time don't even consciously hear me, but they're subconsciously hearing it, knowing, oh, I have permission. It's like the body's like, oh, I can do this. And so whatever's happening, it's happening on its own. And I think it's just helping nudge that the body's innate ability to heal, which we all have. So that's something also that I think is important. Just, just knowing that they have that and it's a resource. I mean, they might not want to talk about it. They might not want to face it, but if they do, we're here for them.
Yeah, we're here for them. That's perfect. And really, I mean, going back to what you said about shared decision making, Dr. Mahabir, what Dr. Kurtovic said is all part of that. Because sometimes we have to shore patients up and strengthen them and let them know that we're validating what they're feeling, and just to open up their ability to talk about what decisions they want to go through. So that's really wonderful. I just have so enjoyed talking to both of you today. This has been lovely. I'm so glad to meet your lovely partner, Dr. Mahabir, after knowing you for so many years. You have chosen well, I might say. Not only just such a wonderful, beautiful person, but also your skills combined are amazing. So I'm really happy to provide this information for patients because it's all about access. And you both know that in the world of microsurgery, it is such a specialized program. We don't have microsurgeons available in every town. People must travel to go, sometimes to a surgeon, but they also need to know what questions to ask. You just covered so many wonderful topics today, and I really appreciate it. I'm looking forward to having you back on the program again. Is that all right? Can we just
Absolutely.
make that happen?
Absolutely, Terry. You tell us when, and we'd be happy to help any way we can.
All right. Well, again, I am talking to Dr. Raman Mahabir and Dr. Silvia Kurtovic in Tucson at Tucson Plastic Surgery in Arizona. Thank you both so much for joining me today.
Thank you for having us.